Good morning, everybody. I'm very happy to be here and present to you today my research on vaccine-induced HPV-specific antibodies in cervicovaginal secretions, or shortly CVS. So the reason that I kind of stand here today to talk to you is because I wrote a review on this. The review was a little bit broader, also including infection-induced antibodies. But for today, we're just going to focus on the vaccine-induced ones in CVS. I want to go with you through the reason why we conducted this review, the results from the papers that were selected, then zoom in a little bit on the methods that were used to collect this CVS, but also to detect the antibodies, and then also small things on the influencing factors of this detection and some conclusions. So let's start with the why. It was already discussed this morning. So HPVs are specifically epitheliotropic. So they infect and propagate in the mucosal epithelia as the female genital tract. They are not causing any viremic phase. So that's why it's important, we think, that next to measuring the effective immune response in blood, that this effective immune response is also present at the disease-relevant site, so at the cervix. So we went and looked at all the papers that investigated this, more specifically that looked at the antibodies in CVS. In this way, we wanted to assess what is the current knowledge about it and also to help future studies that want to investigate it. Before going to the results, I want to highlight so that there are two mechanisms next to the transudation. That is probably via the neonatal FN receptor. We also have another mechanism that is the exudation. So as HPV requires disruption, the antibodies are also coming in via the a direct exudation of the capillary HPV specific antibodies to the mucus. So what we have found, the search was done in March 2019, were 13 studies that published 18 papers on it. And all the papers reported paired CVS and serum data. I don't know what your feeling is about this, but I expected this to be more. From the 13 studies, there were 3 that investigated the antibodies after experimental vaccinations. Now, one study looked at the responses after the quadrivalent vaccine, but they administered the vaccine mucosally. And then there were 7 studies after the bivalent vaccine, and 2 did a comparison between the 2 vaccines. We also included 1 letter to the editor. As you can see from the studies, there were they all did the vaccine with 3 doses. So we don't have studies for 2 doses, 1 dose. Also, no nonavalent vaccines were investigated. And of interest, what we were thinking was also studies that would invest these antibodies after vaccination when women are treated, because that's also now in the pipeline, different studies investigating this. So the first article about this topic was published in 2003 by Naidarli Heifliger. She conducted the research because she was interested what these vaccines would, if they would result in antibodies at the female genital tract, but also if there would be variation if people are using contraceptives or during ovulation cycles. Her results were very promising in terms of the vaccine efficacy because all the participants showed a relatively high titer of these antibodies in their secretions. She used for this study sponges to collect the CVS. What she also reported was that there was a reduction of the antibodies just before ovulation, and that was a little bit of her concern, that the vaccine would be less efficient because of that. However, it was not of concern from Bar, and also from was from the discussions today. Bar wrote a letter to the editor for her because he was thinking, because all the efficacy that we have, maybe the titers are fluctuating, but it's still at a high enough level to provide protection, or maybe it's not of interest what is happening in the CVS, but it's important what the levels are in the serum. Next to the study of Nardelli, there was 1 year later also a study of FIFE in a dose-ranging study that had less promising results. There were the cervical positivity was much lower. The reason for this was said that it could be to the method of sampling. They used lavage in this study. Next to these two more experimental studies, there were also two studies that investigated the CVS antibodies after mucosal vaccination to provide an alternative to intramuscular immunization. But however, the studies here the results were not promising as what was shown in mice. So next to all the experimental studies, most studies were done looking at what's happening in the CVS after bivalent vaccine. Here you can see a table of all the studies. So in total there were 7, and you can see that they all sampled for CVS at different time points. The longest that we have is from Schwartz, that presented also this research this morning, so after 10 years. What we can conclude from the studies is that the antibodies were detected, but in 5 to 45% of the cases, these antibodies could not longer be detected, although the titers were still there in serum. And these percentages became higher after a longer period after the last vaccination. So from this table, you can see after 7 months, we had percentages, CVS positivity for 95, 92 for HPV 16 and 18. But at the month 36, this became 87 and 73. What also was indicated that serum antibody titers were consistently higher in women who had detectable antibodies in the CVS. So what we can conclude overall is that when antibody titers are reduced or cannot longer be detected in serum, there will be also fewer antibodies that translate to that CVS. The other 2 studies that we included in the review were the 2 that really went and looked at the difference between the vaccine. As expected here, as the Cervarix is having higher titers in their serum, there were also more women that had higher titers in their CVS. However, as also indicated, we have to have other studies to look if this is of some clinical importance. Most studies that did this research were very interested in the correlation with serum. And overall, we can say also what we already heard is that there is a moderate to strong correlation with what is found in serum and CVS, indicating that there is transudation of the serum to the mucosa. As the studies were really interested in the mucosal antibodies to avoid any possible bias introduced by the presence of blood. In most studies, the samples that were containing the blood, these were excluded for analysis. If you look at the titers that were detected in CVS, 3 papers reported 0.5 to 50% of the systemic levels, 2 to 3 logs lower than the systemic levels, and 2%. So we can clearly see that the levels are lower. However, they could be still sufficient to offer protection, as we don't know the correlate of protection. Then there was another 2 studies that investigated next to the vaccine type-related antibodies, also cross-reactive antibodies. They also find here these antibodies in the CVS, and also a good correlation with serum. However, these titers were even lower than the titers that were found for the vaccine types. If we zoom in now on the methods that were used for all the papers, we can say that overall, and also in the coffee break, I had a small discussion with Schwartz that he was saying that it's difficult to collect the genital female secretion. And also, if we see at all the papers that are published, there is not an absolute method of sampling these secretions. The most used method was lavage and wicks. But however, there are all disadvantages and advantages of these methods that we sum up here in this table. So the positivity, the advantages could be that there is a minimal trauma, no dilution, minimal dilutions, if there is sufficient material collected, if it's easy to collect, if it could be used as a self-collection method. However, you can see that all methods have some disadvantages. If we had a look at other research fields, we found that in the HIV research, and also after a newly produced chlamydia vaccine, they used to collect the CVS soft cup, and there they find a higher yield of total IgG. Next to that, also here at the research unit, we investigated first for urine as a liquid biopsy to detect these antibodies. However, the sensitivity is still low. We find good correlations with serum. This sample could also include young participants, could also increase participation in the trial, and also could avoid trauma. Next to the collection methods, we also had a look at the immunoassays that were used. As we have a sample with very low concentrations, we need an assay that has a good sensitivity. There were several assays that were used in all the papers, and most studies did not look at the neutralizing antibodies because there was BioCamp a publication showing that there's a good correlation with the ELISA titers, as also shown in serum. If we had a look at the cutoff that was used for serum, that's relatively easy. You can take blood of children. However, CVS from children is not ethical, so most studies here used an arbitrary cutoff. So as we were not able to compare all the studies, we were also very supportive to the initiative to standardize and harmonize all the assays for HPV antibody detection. Looking at the influencing factors, I already said that the menstrual cycle could be of importance, the blood contamination, but next to that also the age is of interest for this meeting. A lot of researchers are reporting that there would be less secretion produced because of older age. From the studies that we found from the review, although the data is very limited and the oldest age women were 55, they were still finding good correlations between CVS and serum, and there was a transudation in CVS regarding of age. But however, more research is necessary to make hard conclusions. All the papers used some normalizing to present their levels in a normalized way to correct for these changes. This was mostly done by dividing by the total IgG. So in conclusion from this review, what I can say is that the data is very heterogeneous. So I was not able to do a meta-analysis on this. However, what we can conclude is the vaccine-induced antibodies are present in CVS and can be detected, although they are at a lower level. And it was possible with a wide variety of collection methods and immunoassays. But however, for the future, there is a need for methods that could improve the sensitivity and also standardize the detection of these antibodies in CVS. Thank you.